All right, let's dive right into this explainer and completely demystify the incredible biochemistry behind how our bodies perfectly balance calcium. Honestly, it's one of the most vital yet entirely underappreciated balancing acts happening inside you right at this very second. I mean, it dictates literally everything from how your heart beats to how your muscles move. So today, we're going to unpack the elegant, invisible machinery that keeps your biology in check. So, here's our roadmap for today. We'll start with the Calcium Balancing Act, then meet the regulators, dive into hypoparathyroidism, the lows, swing over to hyperparathyroidism, the highs, and finally, wrap up with diagnosing the imbalance.
Section 1. The Calcium Balancing Act. Let's establish our baseline normal.
To really ground ourselves, we have to start with the anatomy. Tucked right behind the thyroid gland, you'll find 4 tiny, yellowish-brown, egg-shaped powerhouses. These are the parathyroid glands. And when I say tiny, I mean they are incredibly small. Each one is about the size of a grain of rice. They'd be almost easy to miss if you weren't looking closely. But their impact on our physiology, absolutely massive. These 4 little glands are basically the master controllers of our body's entire calcium vault.
Moving on to Section 2, meet the regulators. Let's get to know the body's specialized chemical bank managers. So, how do they actually manage the vault? Well, they use a brilliant negative feedback loop. Whenever plasma calcium gets too low, it immediately triggers the release of parathyroid hormone, or PTH, to bring those levels back up. Think of it exactly like the thermostat in your house. But instead of monitoring temperature, these glands are constantly, meticulously sensing the exact concentration of calcium in your blood. The second those levels dip, boom, the alarm sounds and PTH is deployed straight into the bloodstream.
Let's break down the mechanics of how this actually works, because it's fascinating. PTH executes this highly coordinated, 3-pronged strategy. First up, it forces the kidneys to lock down and hold on to calcium, rather than just flushing it out in your urine. Second, it supercharges your intestines, using calcitriol, which is the active form of vitamin D, to significantly boost how much calcium you absorb from your food. And third, it signals your bones to literally dissolve their own calcium phosphate crystals. That releases stored calcium directly back into the blood.
But hey, what goes up must come down, right? That is where calcitonin steps in. This is a 32 amino acid hormone released from the C cells of the thyroid, and its entire job is to lower blood calcium levels. You can think of calcitonin as the body's emergency brake. If calcium gets a bit too high, this hormone shuts down absorption and tells the bones, hey, start depositing and storing that calcium again. So the absolutely crucial point here is this rivalry. PTH raises serum calcium by pulling it from the bones and kidneys, while calcitonin opposes it by stopping absorption and promoting bone deposition. It is a constant, minute-by-minute tug of war. And it's all just to ensure your serum calcium stays exactly in that perfect sweet spot. You need to do something as simple as blink your eyes or take a step.
Section 3, hypoparathyroidism, the lows. Let's see what happens when levels drop. Now, what happens when the parathyroid is damaged? Say, inadvertently during a neck surgery, like a thyroidectomy. Well, we see low PTH, which causes a really dangerous drop in calcium, known as hypocalcemia, and a corresponding spike in blood phosphate. Essentially, without our chemical manager around, the calcium vault gets locked shut. Your blood is starved of calcium, while phosphate just builds up unchecked. There's actually a really handy way to remember the startling clinical symptoms of this hypocalcemia. Just use the mnemonic CRAMPS. That stands for convulsions, reflexes that are notably hyperactive, arrhythmias, like a prolonged QT interval on an EKG, muscle spasms or tetany, positive signs, which we'll talk about in just a second, and finally, a sensation of tingling or numbness, which is medically known as paresthesia. Going back to those positive signs for a moment, they are quite wild to see in physical action. Just lightly tapping a patient's cheek can cause this involuntary facial twitching known as the Chvostek sign. Or, inflating a blood pressure cuff can induce a severe carpal spasm called the Trousseau sign. These aren't just random twitches. They're textbook physical indicators that a patient's peripheral nerves have become severely hyperexcitable, all because the calcium levels that usually stabilize them have completely plummeted. Now, here's a really interesting twist. In a rare genetic condition called pseudohypoparathyroidism, the body actually produces plenty of PTH. But dysfunctional G proteins mean the calcium-sensing receptor homodimers simply ignore the signal. So it's like the manager is frantically shouting instructions through a megaphone. The BTH levels in the blood are sky high, but the cellular vault door is completely deaf to the command. It's a truly fascinating display of hormone resistance. Section 4. Hyperparathyroidism. The highs. Swinging the pendulum to the other extreme. In primary hyperparathyroidism, a single benign parathyroid adenoma is usually playing the rogue manager. It excessively raises calcium while actively lowering phosphate. Remember that elegant negative feedback loop we talked about earlier? Yeah, it's completely broken here. This tiny tumor just keeps aggressively pumping out PTH, utterly ignoring the fact that blood calcium levels are already dangerously high. And this massive influx of calcium into the bloodstream leads to a classic, super memorable cluster of clinical miseries. Doctors call it bones, stones, groans, and moans. I know it sounds like a terrible Halloween poem, but it actually represents a very serious cascade of systemic issues for the patient. Connecting that morbid little rhyme to reality, it translates to painful bone fractures, dangerous kidney stones, terrible gastrointestinal groans, and the neuropsychiatric moans of extreme lethargy. Because PTH is relentlessly pulling calcium from the bones, the skeleton weakens, leading to conditions like osteitis, fibrosis cystica. And all that extra calcium, it filters straight through the kidneys, forming painful stones, wreaking havoc on digestion, and even clouding the patient's mental state with confusion and severe fatigue. Alternatively, we have secondary hyperparathyroidism. This is a desperate physiological response where chronic kidney failure or severe vitamin D deficiency forces the glands into overdrive just to fix persistently low calcium. In this scenario, the parathyroid glands aren't rogue at all. Actually, they're behaving exactly as they should. They're just working agonizingly hard, multiplying and enlarging in a frantic attempt to compensate for a massive failure somewhere else in the body's supply chain.
Section 5. Diagnosing the imbalance. How do we actually pinpoint the cause?
If we look at the blood work, it tells a really clear story to help us differentiate the types. Primary gives us high calcium and low phosphate. Secondary shows low or normal calcium paired with high phosphate. And then there's tertiary, which shows excessively high levels across the board. Tertiary actually happens when prolonged secondary hyperparathyroidism causes the glands to permanently reset their calcium sensitivity. Basically, they get locked into an autonomous, hyperactive state. Once that blood work confirms the imbalance, medical professionals can use advanced radiotracer imaging, like SPECT or PET scans, to physically locate the exact hyperactive nodule hiding in the neck. Advanced radiotracers, things like trivexin or sestamibi, literally cause the specific problematic adenoma to light up like a beacon on the scan. This gives surgeons a precise, pinpoint target to remove, which can almost instantly restore the body's natural harmony. As we wrap up this explainer, it really leaves you wondering just how perfectly calibrated our biology truly is, doesn't it? I mean, just stop and think about it for a second. How does a tiny 84 amino acid chain completely dictate the strength of your bones and the firing of every single nerve in your body? It's an absolute brilliant testament to the invisible, elegant machinery keeping us alive and balanced every single second of every day. Thank you so much for joining me, and I hope this deeper look at our internal chemistry sparks your curiosity to keep exploring,